Welcome to our crash course, one of the most debatable topics in the Philippines and around the world, universal healthcare versus private healthcare. We'll break down the ethical dilemmas, social issues, and what different ethical theories say about these two systems. What is healthcare? Healthcare is the maintenance or improvement of health through the prevention, diagnosis, treatment, recovery, or cure of illness or injuries. Let's talk about universal healthcare, also known as universal health coverage, aims to ensure that all citizens have access to necessary healthcare services without financial hardship, often through government fundings or compulsory insurance programs. Private healthcare, on the other hand, relies on individuals or companies purchasing insurance or paying for service directly, providing more choice and often faster access, but potentially at a higher cost.
Let's start with consequentialist theories, which focuses on outcomes. Utilitarianism asks, what brings the greatest good for the greatest number? Universal healthcare aims to cover for everyone, reducing suffering and financial hardships, which maximizes overall happiness. Countries like Canada and the UK spend less per person but have better health outcomes than the US, which relies more on private insurance. Rule utilitarianism would support universal healthcare if the rule everyone should have access to healthcare consistently leads to better outcomes for society. Egoism, on the other hand, focuses on self-interest. Private healthcare allows those who can pay to get faster and sometimes better services. But this can leave the poor behind, increasing inequality. So, do we prioritize the greatest good for all or allow individuals to pursue their own best interest even if it leads to inequality?
Now, let's look at duty-based ethics. Kantian ethics say we must treat every person as an end, not a means. Denying someone's healthcare because they can pay violates this principle. Universal healthcare aligns with this duty to respect human dignity. Divine command theory would depend on religious teachings, but many faiths emphasize caring for the sick and vulnerable, supporting universal access. Right-based ethics, John Locke says everyone has a right to life and health. Universal healthcare tries to guarantee this right, while private system may only secure it for those who can afford it. Is it our moral duty to provide healthcare to all, or is it enough to let individuals secure their own care?
Virtue ethics is about character and habits. Aristotelian ethics asks what a virtuous society looks like. Compassion and justice are key virtues, suggesting a system that cares for everyone, like universal healthcare. Confucian ethics emphasizes harmony and social responsibility. In countries like the Philippines, where families and community are central, universal healthcare reflects these values. Buddhist ethics highlights compassion and reducing suffering, again, supporting access for all. Are we building a compassionate society if we let people suffer due to lack of healthcare?
Now, let's consider context and perspective. Cultural relativism says what's right depends on society's values. Some countries, like the US, value individual choice and market freedom, favoring private systems. Others, like Sweden or the UK, value equality and supporting universal healthcare. Ethical subjectivism means individuals' views differ. Some Filipinos may prefer private care for speed and quality, while others want universal coverage for security. Moral pluralism accepts that both systems can have value and maybe a hybrid model is best, like Germany's mix of public and private insurance. Should we stick to our cultural values, or look for a system that works best, even if it means change?
Finally, let's talk about fairness and social contract.
Social contract theory says people give up some freedom and pool resources for mutual benefit. Universal healthcare fits this idea. Everyone pays taxes, everyone gets care.
Justice-based theories like John Rawls argue that a fair system is one that helps the least advantaged. Universal healthcare tries to do that, while private systems often leave the poor behind.
In the Philippines, universal healthcare faces problems like underfunding, long wait times, and limited services, especially in rural areas. Private care is faster and often better, but expensive and out of reach for many. This creates a gap between rich and poor, raising questions about fairness and justice.
Universal healthcare promotes equality, compassion, and collective responsibility, but struggles with funding and efficiency.
Private healthcare offers choice and innovation, but can increase inequality and leave the vulnerable behind.
No system is perfect. The challenge is finding a balance that reflects our values, meets our needs, and upholds our ethical duties as society.